it's recording.
So we were just about to make this video.
Yeah.
Actually, we weren't going to make this video.
Yeah.
And now Farouk has asked me to do the one on prescribing governance. This is what I'm actually normally like. I'm not that bubbly and I'm not that happy. But when I have to make a video, folks, I need you to get ready for this video because we are about to go through prescribing governance. And that lady at the back there who's laughing, I don't know why she's laughing. She's disappearing. I don't know why she's shy, but anyway, look, it's myself, Ilyas and Adnan. We're here again, and in this video we are going to be talking about part 2, prescribing governance, and this is about the second domain. Okay, Ilyas, starting with Ilyas, what did you learn in the first video? Anything you remember?
Yeah, like how to consult the patient.
Yeah.
We have to take how to take the history of the patient.
Yeah.
And prescribing as per the government's law. Yeah.
Yeah, and you know, I'm actually not impressed by the answer because we literally did it 2 minutes ago. So I don't know why he's forgotten already. Literally, it was 2 seconds ago that we did this. But anyway, in the first video, what we did is that we spoke about the consultation. We said that in order to prescribe, there are 2 things you need. You need to be comfortable with the consultation, where you're gathering all the information from the patient. You're making sure it's done safely. You're making sure it's done safely. You're making sure you follow a procedure. You're making sure it's evidence-based. You're making sure you're doing it in a partnership, like a marriage. And you're making sure that you're monitoring. That is essentially what happens in the first. In the second part, it's all about now prescribing. This is the part where we say, right, we've diagnosed you with having happy syndrome, where you stay happy all the time. That's what you have. Okay, and you're always smiling. We've diagnosed you with that. And what we now have to do is we now need to prescribe. So the first thing is prescribing safely. How do you make sure that you're prescribing safely? Any ideas, Adnan, what comes to your mind with prescribing safely?
Follow the regulations that have been set out from the RPS.
Yeah, so following the regulations. So that could be by the GPC, that could be by the RPS, your professional body, that could be by the MHRE, whatever it might be. Is make sure when you're prescribing safely, following regulation. Also making sure that when you're prescribing, you're making sure it's the right medicine, the right dose, the right strength, and for the duration. So you've got to make sure this is correct. Okay, so that's going to be important as well. So that's the key thing. In prescribing safely, we're going into the medicine itself. Everything that has to be done to make sure that they benefit from the patient. Well, they benefit from the patient. They benefit from the medicine. Okay, so medicines have side effects. Glycoside has side effects. Metformin has side effects. They all have side effects. So it's going to be important to make sure that your patients are aware of side effects, how to spot side effects, how to manage the side effects, maybe when to discontinue the medication, making sure that they're prescribing safely, meaning, can I prescribe everything?
No.
Why?
Because like if someone has a different problem, then you should cure that problem, not different like you cannot give the different medication for as you like.
Correct. So he's onto something here. What he's basically saying is that you have to prescribe within your scope. You have to prescribe in your scope of practice. You have to prescribe in your specialism. As a pharmacist, you'll be a specialist in something to prescribe. As a doctor, you'll be specialist. So I can't prescribe everything. So when it says prescribe safely, it also means making sure that you know your limitations. You can't do everything. So that's also included there. Then we've got prescribing professionally. Making sure that you are professional about your prescribing, making sure that you communicate your prescribing with other doctors and nurses and so on. So this talks all about prescribing professionally. That's important. Actual fact, I can't remember exactly what's included in prescribing professionally. Let's get into this. Let's really look at this. Have a look. What do we have? What do we have in this? Right. Ensures confidence and competence to prescribe are maintained. That means when you're speaking with the patient, you must come across confident. Because if you're not confident, they're going to say, you're prescribing for me, but you yourself don't know. For example, I say, wait, hold on. I can't remember what I'm going to prescribe you. Let me open up the book. And now in front of the patient, opening up a book, come on, he's having a heart attack. He's okay, just hold on. He's having a heart attack. What do I give him? What do I give him? That's not prescribing professionally. Okay, that's what it means, maintaining professionalism. Okay, accepts personal responsibility and accountability for prescribing. Okay, let's say Adnan starts the medication for happy syndrome and starts the patient on fusudic acid, right? I then continue prescribing this. Would it be acceptable for you as a patient for me to say it wasn't my fault? It wasn't my fault. He started the medication, I just continued it. I don't know why he prescribed it. Would you be happy as a patient with that answer?
No.
Would you be happy for me to say, look, it's his fault. He started it. I'm just continuing. Is that professional?
No.
No, correct. When you prescribe, you're responsible. So if you're working in general practice or you're working in community pharmacy and you haven't upskilled yourself and you haven't developed your confidence or skill set or knowledge, get in touch with us at Medland, get in touch with Ilyas, because we can help you develop your skills so you can prescribe safely. Okay, so that's all about prescribing professionally. And there's more to it. Improve prescribing practice. How can you help a pharmacist improve the prescribing practice? Any ideas?
Like he must be attending more patients so that that's how he get the experience in.
Okay, any ideas?
I can talk about gaming.
Okay, he can talk about...
I can talk about gaming because that's what I enjoy doing. So if I wanted to improve my, say, in playing cricket, as an example, I'd go out and continue practicing. I'd get a coach or a mentor who would then look at my techniques and let me know where I'm making mistakes to improve it against certain bowlers, so fast bowlers, spinners and stuff.
This is great. This is great. Great. Right. I like this because essentially what he's saying is to become better at anything, it's practice, okay, but it's the right practice. If you keep practicing the wrong thing, you're going to get wrong results. So that means that you need a teacher, you need a mentor. And any of you that are struggling with finding someone to inspire you, motivate you, teach you, train you, get in touch, we can help you. So to improve your prescribing practice, you need to be part of a team. You need people to have a look at what you're doing, to supervise you, and also critique you. Critique doesn't mean just criticizing, it means looking at what you're doing, why you're doing it, and questioning you. Actually, why are you prescribing this? You know, to get you to think from a different angle. Sometimes we get so used to doing the same thing again and again. For example, I have a set way when I do my YouTube videos, but now I'm being watched by others. They might give me some ideas. Actually, it's not the right way to do it. Have you thought about this? Have you thought about that? Recently, they're laughing about my haircut. I don't know if Farooq was saying something about that I always get the same haircut. I'm not too sure why.
I like it.
He likes it, but apparently I only go to one person and he only knows one haircut, so I only get one haircut. Yeah. I don't think that's true, but that's what he was saying. The point is that you can improve your prescribing practice if you're part of a team and you're being monitored and you want to improve yourself. You've got to improve yourself always. You know, we invest in the latest gadgets, but what we don't invest in is this. This is the most important gadget. You should be teaching, training, educating yourself. If you're watching this video and you haven't learned something new in the past couple of days, something is wrong. Okay, always educate yourself, train yourself. Then prescribing part of a team. Just like we're a team here. Prescribing part of a team is very important because you're dealing with patients. Patients are complex. You're not dealing with a teddy bear. Okay, this is serious stuff, so you've got to be part of a team. Sometimes you might have to ask Dr. Anam or Physio Teja or, you know, Surgeon Farooq. You might need to ask some questions, okay? So it's prescribing part of a team is very important. So this video is now going to conclude the two key areas. In the next video, we can start to look at each framework and go in depth. So, I don't actually have a special announcement today, so there's nothing else for me to say. I'd like my friend, my colleague, my brother, everything, and Farooq might get a bit jealous because he didn't like it when there's other people involved, to finish off this video, and I'm going to leave it with you,
All right.
okay, to finish off this video. Tell everybody something.
Well, the first thing is, this is my first video.
Second.
Yeah, it's a second video. Just before we made one video, and as Fahim Bhai just told that you have to educate yourself, learn, teach, and someone has to monitor. So the best thing is you can watch our YouTube channel. You can go to Fahim Ahmed channel. From there you can find plenty of videos on different things, and we also do the webinars. So that's how you can get the knowledge. And I do follow him as well. Thank you. And I wish you best of luck for the next year. And yeah, I request you to like, share, and subscribe our channel.
Thank you, Ilyas.
Thank you.